Facelift. What is a facelift? Facelift is a procedure that will remove the excess skin off the face, of course. We replace sometimes the lost volume and reorganize the tissue that has fallen through time. So many times, face, lower face, upper face, or the neck starting becoming droopy. The skin goes through changes. We lose volume in both muscle and fat, soft tissue. So we're replacing that volume loss, at the same time replace the tissue that has been fallen down to the proper position, reposition them, and remove the excess skin. It's a procedure that can be done under sedation or general anesthesia, or sometimes even pure local, through which we make an incision hidden in the hair-bearing area and sometimes inside the ear all the way to behind the ear. And through this, we improve pretty much all the lower 2/3 and the neck through a very minimal visible incision. It's a procedure that can take about 3 to 4 hours depending on the complexity, and sometimes we make a small incision in the chin to actually put the muscle together, give a nicer contour to the neck. Who is a good candidate for facelift? It's a very good question because a lot of it depends on the patient. Now, the average age of facelift, believe it or not, is about 45, so it's pretty young. But again, it depends. Many people, their genetic is in a fact that they don't go through a lot of these changes at early ages, so we're looking more in 50s or 60s doing facelift. And some people even in late 30s or early 40s, you get a lot of these skin laxity, dermatoclasia, that there's a limit to do with technology. There's a limit to improve with fillers and neuromodulators. So in those patients, what you can achieve with facelift, you can never achieve using non-surgical, because it remains much more natural, at the same time much longer lasting, and even it becomes more economic in the long term. A result of facelift usually lasts for about 10 to 15 years. And usually it actually improves your appearance for about 10 to 15 years. Is it a procedure that can be done on the local? Yes, as mentioned, very simple. Many times we can do it on the pure local, depending on the amount of work needed, depending on the area that we need to work. Do we need only the neck? Do we need the neck and lower face? Do we need also to work on the side? And there's a wide variety of shapes we can do. We can even modify the shape of the faces slightly, but the whole idea is keep you as you, just a younger version, not to change your shape, not to change your face. But in some men, for example, they desire to get a more of an angulated look. We can do it using only a facelift. Some people decide to slightly change their face, and that's doable. But not all patients want to change. So majority of my 99% of my patients, they just want to keep the same shape they had, just look 10, 15 years younger, look less tired, look less fatigued. And this is a perfect procedure that can be done easy, 3 to 4 hours, and really can reverse the timing for a good 5 to 10 years, lasting for a good 5 to 10 years.